How does your butt know the difference between a fart and a poop? Simply, it comes down to embryology, but there's an important line in your anal canal known as the pectinate or dentate line, which divides the anal canal into an upper 2/3 and a lower 1/3. Because the upper 2/3, shown in orange, derives from endodermal tissue, its nerve supply is by visceral nerves, whilst the lower 1/3, shown in blue, derives from ectodermal tissue, so it has a somatic nerve supply, similar to the skin. This is by the pudendal nerve. But what causes this divide? In the embryo, there is a long tube known as the gut tube. This will eventually become the digestive tract. This tube can be broken into the foregut, the midgut, and the hindgut. The hindgut is in continuation with the urinary system and merges at a location known as cloaca. By the end of the 7th week, the urinary system and the hindgut separates. The cloacal membrane will rupture, which allows 2 separate exit points. The ectoderm, shown in blue, will then invaginate into the hindgut, forming an anal pit. This is known as the proctoderm, which forms the lower 1/3 of the anal canal and ends at the pectinate line. So when wind or feces enters the anal canal, it will stretch the walls of the intestine, activating pressure receptors and taken back by visceral nerves, telling you that something is entering the canal. But it's not until it reaches the pectinate line that the stretch receptors become cutaneous receptors, like the skin, and from here onwards you can distinguish between wind and feces. Therefore, you can decide whether you're safe or you need to use the bathroom.